Thank you for coming today to this Lunch and Learn. I am a big breastfeeding advocate. My name is Monica Smith. I'm the Extension educator here at Kent MSU Extension. I have a master's in counseling, and I'm a registered dietitian as well. And I decided to get my master's in counseling because I realized after about 6 months in the field, it's not about the food. It's about everything that goes with the food, right? So one thing they beat into your head as a dietetics intern is stay within your scope of practice. And I'm so happy that breastfeeding is within my scope of practice because this is something that means a lot to our community, a lot to our children, and a lot to many of us personally. And you know, I don't know if you find this out. You think that you know something about something, and then you do some research and you find out you don't know much. So I'm doing this and I'm finding out so many things that I didn't really know, things I guess I should have known. And I'm going to be talking about what a community can do to support nutrition and health through breastfeeding. Just out of curiosity, I want to know who's here. In health, how many people are in health? Is it everybody? Education? Who's left? Social work. I consider that health, mental health. You can't get very far if you can't keep it going, can you? So, okay. So I might be singing and preaching to the choir, but maybe not, because in the middle of doing this, I changed my mind. First of all, I just want to remind you that this presentation is brought to you by our friends at the USDA, and we are an affirmative action equal opportunity employer. We don't discriminate against anyone, nor do we hang out with people that discriminate against others. So anybody that participates with the MSUE, you know that we are all happy to have every single citizen that we can grab that's eligible, regardless of anything. I found this quote when I started this presentation. Wow, isn't this true? You know, where there's poverty, the only gift a mother can perhaps give her child is breast milk. How many of you see families every day and the only gift that they perceive that they can give their families is food? To the point maybe where they give their families too much food? Yeah. Food's pretty primal. You know, you're all in health. You all know this. You know, why? We're talking about, this is about a community thing, right? What does breastfeeding have to do with community health? Well, look at that infant mortality rate. Look at that African American infant mortality rate.
Monica, where was that? Where's that specific to?
This is U.S.
U.S., okay.
U.S.
All right.
Okay. This African American mortality rate, look at that. This is Kent County, African American. Low birth weight. This is Kent County. Food insecurity. Does anybody have any idea? I didn't know this before I started working with the Essential Needs Task Force here in Kent County. How many food insecure people are in this county? It's unbelievable. Access, just the 11 key pantries through Access, 84,520 individual food services. Unduplicated families, 18,594 last year. That will be higher this year. Food insecurity is a huge issue in this county. Breastfeeding has a lot to do with that. Not to mention the cost associated with treating bottle-fed infant health issues. Has anybody here ever worked in the ER? Has anybody here ever had a client go to the ER for diarrhea? Wow, that was a $1,000 episode, wasn't it? There are a lot of costs associated with bottle feeding. You know, this is just the economic costs of formula feeding. Look at this health care, $3.6 billion a year. You guys know this. I think this is very, very low. $331 to $475 additional dollars. for bottle-fed infants for each HMO? Come on, how much does it cost to treat one ear infection? I mean, really, that's got to be, you walk into the doctor's office, it's $100, right? You walk in, you say your name, bing, $100, right? This has got to be way underestimated. Not to mention food assistance, going back to that food insecurity thing. Breastfed babies cost about half what a formula-fed baby cost. Well, we know that. I mean, going back to that food insecurity issue, if you were working at a food pantry, wow, that's a lot of difference, isn't it? If you're at a food pantry, you have a family has an infant, family A breastfeeds, they get this much from WIC. Family B doesn't breastfeed, they get this much from WIC. Who's going to make up the difference? Okay? My guess is the pantry. Again, look at this. Breastfeeding woman, formula feeding woman. It's the end of the month. This milk's long gone, right? Anybody been to a food pantry? Oh, you've got to go. If you haven't been, I insist that you go. This is crucial. Milk is like gold. You don't get milk at food pantries. Very, very rarely. Fresh fruit and vegetables. You can get them at the pantry sometimes, but you know why the pantry gets them a lot of times? Right for today. Right now, this minute, go home and make, beets. It's a lot of pressure for somebody that's already stressed out of the food pantry. Eggs. 2 versus 1, that's another like gold commodity from the food pantry. There's a big difference here. Now, at food pantries, a lot of that food is gleaned, right? So it would have gone to waste. So you say, well, doesn't cost us any more money. Sure it does. It's got to be moved, warehoused, distributed. There's quite the cost associated with that. You know about all this. You know all the reasons we should breastfeed. None of this is anything new. Okay? We know that. Health benefits of breastfeeding. So what? How many people work with clients in crisis? Okay? If you're in crisis, do you care if smoking today gets you cancer in 20 years? No, you don't. If you're in crisis, are you really thinking about lymphoma for your child? I don't think so. But we know these are wonderful things, but in the whole scheme of things, how is this affecting my community's choices? I don't really think it is. Okay, here we go. Any breastfeeding. Is anybody surprised by this? That the Hispanic folk, though you can't see it that clear, Hispanic folk on this are the highest one. Is anybody surprised? No. Is anybody surprised that non-Hispanic black folk here are the lowest? Is anybody surprised? I'm not surprised. Okay? But wait a minute. Let's think about this a minute. By income, it looks like people that make more money breastfeed more, right? Wait. Is this me, or is this a cognitive misalignment? Are most Hispanic folk in the higher income bracket? No, not here, not in most communities. But that's what it looks like. These two slides contradict one another, don't they? Yeah, what's different? Why? Why could these two be contradicting one another? What do you think? How come we have these Hispanic families who aren't high-income people breastfeeding?
Culture.
Oh my gosh. Could it be culture? Could it be expectation? Could it be normalcy? Oh my, wait a minute. It's not access to medical care? Right? No, it's not language barrier. Mom and baby both speak Spanish perhaps. It's not a language barrier. Okay. All right. Keep wrapping your head around this. I'm thinking about what's happening with my community. Why is my community, and it's not just us, people. Don't beat yourselves up. I looked all over. I looked at states all over. Nobody is winning this race. We've put lots and lots of effort in since 2000, and we're not getting a lot of return out in any state. How many babies did Butterworth deliver last year, do you think? 10?
7,600.
7,600. This weary woman to my left states. 7,600 babies out of one hospital in one Midwest city of medium proportion, right? We're not even a 500,000 city, although we serve a metropolitan area of hitting around 1 million, though, right? I looked at a study. It was such a nice study about this wonderful impact that they had had. They put, it must have been $200,000 they put into this puppy. 20 moms. They had this wonderful outcome with 20 moms. I don't think we're going to be able to make that fly nationwide. Okay?
You're saying they? Who's they?
The people that did this study was out in California,
Okay.
and I was like, oh, folks, that looks good, but that's not going to be, we can't replicate that. Nobody could replicate that. Basically, it was, let me bring you home with me and hold you by the hand. And even that doesn't work so good because some people don't like that, right? I don't particularly care for that. I was looking at this. The U.S. national rate is 43%. The lowest, Louisiana and Mississippi at 21. The highest, Oregon at 62. Is anybody surprised by that? No, you're not too surprised by that, are you? You're thinking, yeah, yes, ma'am.
I just want to throw in a quick comment here. The Chicago Doula Project, they picked the 3 lowest income clinics in Chicago, greater Chicago. They introduced their doula program. On one of their sites, they had their breastfeeding rates go from about 0.2% to like 98%. It was just mind-boggling, and it was like in a year. It wasn't like over a 10-year period.
And how many moms were affected with this?
I don't remember those raw numbers on it, but each clinic saw
Huge changes.
They were very large. Chicago, so the Chicago Doula Project.
Could that have been a change in culture at those clinics? Something big had to change. Here's where we are.
In the county?
Yes.
Where'd you get the 31% of breastfeeding? When
Oh, why didn't this do? Let me go back. At 6 months. This is Kent County. This is between 2 and 6 months.
I have to ask a question because the CDC, see the problem with this is everybody has a different definition of breastfeeding. The CDC says one thing, ILCA says one thing, and when you collect data, you say, is your baby receiving breast milk is sometimes the only question. So is that breastfeeding if you breastfed once a day?
This is any breastfeeding.
Any, okay. So only 31.5% at 6?
At 6 months. Between 2 and 6 months, because the data I was given was between 2 and 6 months. Okay? So my guess is at 6 months it may even be less, right?
Is this the WIC population?
This came from the study that Barb gave me. It was from Michigan state of Michigan, right?
Grand Valley?
Grand Valley.
Survey Grand Valley.
Okay.
That was not.
Okay. So we didn't meet the national, but we're not quite as low as Louisiana, right, and Mississippi, and we're nowhere near Oregon. This is something I found was interesting. Louisiana, Mississippi lowest, Oregon highest. We're slightly above lowest. Look at the obesity rates. Most obesity, least breastfeeding is what that looks like. I mean, I can draw these inferences. I may or may not be correct, but just looking at this, all right? Least obesity, more breastfeeding. Middle obesity, slightly more breastfeeding. Okay, maybe I can draw that inference, maybe not. Cardiovascular disease, less here, more breastfeeding. About the same as these two up there, a little bit more breastfeeding. Diabetes, look, a lot more diabetes, less breastfeeding. A lot less diabetes, a lot more breastfeeding, somewhere in the middle. Lack of health insurance, less breastfeeding. Better health insurance, a lot better breastfeeding. Oops! It doesn't hold true here, does it? More health insurance did not create more breastfeeding. The numbers don't really work, and I'm looking at this and I'm thinking, what's the big picture here? The whole big picture for those communities. What do you think Oregon might be saying to us about breastfeeding or about their health?
Oregon has the most people who are runners in the entire country. More athletes are in Oregon. It's a culture.
It is a culture. And not only is it a culture, it's a known culture. Everybody in Oregon knows that they're health conscious, right? Nobody moves to Oregon to do this. Okay? Oregon sees itself differently. And for all our access to health care, our diabetes rate doesn't look all that great, does it? Nor does our cardiovascular rate, nor does our obesity, nor does our breastfeeding. Can I make a suggestion? Let's move to Oregon. No, it's too gray there. Can we just release the fact that it has to do with medical care and insurance? Can we just release that for the rest of this presentation and open your mind to the possibility that breastfeeding and our perception of health in our community is not 100% tied to access to medical care? Let's just release that for the next few minutes. Okay, let's just pretend like. I could be wrong. You know, I have to tell you, I usually have 15 people here, give or take, some months a little more, some months a little less. I put this out for breastfeeding, and who are not here? Who is not here right now?
Your education folks.
My folks are not here. Sarah. She's steadfast and true and has come. So, do you see that people, my folks from the food pantries, don't see breastfeeding as important to what they do? Grand Rapids Public Schools doesn't see breastfeeding as important to what they're doing. Grand Rapids Housing Community doesn't see it. The seniors don't see it. I get a wide variety of people here. The faith community doesn't see it.
Who does? I mean,
Here we are. Here we are. Here we are. I rest my case. Because if you are working to reduce hunger, I usually get multiple people from food pantries in here. Decrease health inequalities. Okay? Educating children. Worried about rising cost of health care. Worried about your employer zapping your health care. Is anybody worried about that? Okay, I don't know about you guys, but we're staffed pretty tight around here. If somebody's out, somebody's work doesn't get done because there's no extra. That affects us. Oh, the social worker left. Come back, social worker. I finally got to yours and you were gone. Do you see the effects of poor mother-infant bonding in your work? I have a dream that one day I'm going to get a grant that's going to let me study juvenile delinquency and breastfeeding. That's one of my personal dreams. When that happens, believe me, you'll all know. Anybody doing this should be concerned about breastfeeding, any of this. But yet here we all are, the people who are not afraid of breasts. We say breast and we run people off. Okay? I'm going to tell you though, I'm not going to let this go. Next month, I'm still going to present some of this information. Whatever lunch and learn I have that brings back my other folks, this is still. This, yes, I am.
I always like that about you, Monica.
You know, we could sit here and we can hum and sing and, you know, breastfeeding is so good that why aren't more people breastfeeding? You see, you know, she's catching it again. Yeah. And that's it.
You even get that. I'm currently breastfeeding. You get that from your family. I mean, my mom's like, you're not going to do it till you ask for it, are you?
It. A breast called it.
Yeah. Or if my father's around, I have to go in another room, or he goes to another room, or.
Yes. Yes, ma'am. You're right.
Even in my own house.
In your own home. And do you think that she's a freak of nature? I don't. I think you're in good company with many other women doing the same thing that you're doing. And what does that have to do with? Does that have to do with your medical insurance?
No.
Does it have to do with you having lots of extended service?
No.
No.
And I think the saddest part, when she said that, it made me realize, my oldest child is 40. And so he was born in 1969, when only 25% of women were breastfeeding. And it was referred to as it then. My mother wanted to know when I was going to stop it. My pediatrician wanted to know when I was going to stop it. Everybody wanted to know when I was going to stop it. And finally, I started, lying. I mean, basically, I was a closet nurser because there was no support, and I just get tired. You just get tired.
You have X amount of energy. Energy is a finite resource, right?
And,
Yeah. Now, if you had been Hispanic, would it have been it?
I don't think so.
I don't think so either. You know, this is a real complex issue. We all know that. Culture. Not just the culture of my color or my ethnic background, but my community culture. I live in East Town. I can do whatever I want.
That's true.
I can sit in Marie Catrib's window and nurse from here till the cows come home, right? I don't know if I'd pull that off in some other areas of town. So it really goes right down to the very area of where you're at, right? We're not talking about the culture of Grand Rapids or the culture of Kent community. We're talking about your home, the culture of your home. Your gender, your age, makes a difference, right? Politics, legal rights, feminism. Don't get too lippy about breasts or you will be labeled a feminist or an extremist or something. Don't. What about religion? Some religions, it's considered duty to breastfeed. I had a client at Clinica Santa Maria once a long time ago. She was our first Arabic woman. And she comes, and when she comes to the clinic, she's with, I guess, I don't know what to call it, a group of women come with her, elders come with her, and you speak to the elders. You don't speak directly to the woman. And I'm thinking, I don't know what I'm doing. I'm just winging it. I've been a dietitian all of about 3 minutes when I get her, of course, because that's how life is. And I say, and I don't know what to say. I don't even know if I can say the B word. I don't even know if I can say breastfeeding. I'm thinking, oh my gosh, I've got nobody to ask. And the reason the family chose this clinic is because it was very female-oriented. All the providers were female. They were comfortable with it. And so I asked her, I said, will she nurse the baby? And the mother looked at me. I thought, okay, they don't know nurse. Can we assume that she will be breastfeeding the baby? And the mother looks at me again, and she's getting really annoyed. And she looks over at the grandmother like, I thought, oh my God, they're going to walk on me. I'm really messing up here. And I said, do you need information on bottle feeding? Of course not. Of course she will breastfeed. Why are you wasting my time? All babies nurse. And I'm like, I have offended her. She must have thought I was calling her stupid. Okay? I felt like, we have like 16, 18, 20 more of you folks where I've got 3 generations of women supporting this new mom to be with the full expectation of nursing, and everybody can talk about breastfeeding. Imagine my surprise. I didn't know. But for them, it was duty. Other religions, modesty. You wouldn't breastfeed because it would be immodest, at least not outside your home. What about medicine and all the power that implies? The doctor you go to, the hospital you deliver at makes a difference, doesn't it? Industry, tolerance in the workplace. I had a woman not too long ago, maybe about less than a year ago, wanted help with feeding. She delivered papers. Wanted to know how she could pump and deliver newspapers. Car adapter. I gave her a pedal pump. Okay? Socioeconomic status, we saw that. But it's not just poverty, is it? Because we saw, wait a minute, that didn't work with the Hispanic folk. But perhaps perception of success? What is successful? Do you consider yourself successful if you nurse? Maybe, maybe not. That's what poor people do, right? It's what field hands do. So, I'm going to ask you today to consider this. Consider something different. How that we can make a difference with this breastfeeding awareness from a cultural standpoint. We have to change our community. Our invisibility is killing us, people. When was the last time you saw this? When was the last time you went to a restaurant and saw even one mother nursing, much less 2 mothers nursing? At the airport, if there's ever a place that anybody needs to be soothed, it's here, right? I mean, you would have to search for a breastfeeding mother in our community, would you not? I think there's a problem with that because all these infants are eating. Do you have to search to find a woman bottle feeding? No, you don't.
The problem is that mothers of this age generation pump and then bottle feed their babies in public. That's a big problem.
And why do they do that?
That's because they don't
They're still closet feeding. I look, that's a way to closet breastfeed, right?
Let's not do that. You know, I chose to nurse my babies wherever I went, in church, in the restaurants, and you don't have to do it so that you're on display, but, people need to know you can just do that. It's your right, I think.
It's not just that though, there are a lot of women that come into WIC that, they completely associate, the breast as a sexual thing. And so, they have, rather than elders who are, expecting breastfeeding, they have, significant others and parents who are saying that that's wrong even to do, but they want to provide the breast milk.
The first question out of their mouth is, how do I get a breast pump? We hear that.
So that's the culture we have to change, that the breast is not a sexual thing, but it's for feeding, that's why you have breasts.
Not according to this.
Not according to our culture.
Not our culture. And I pump and bottle feed in public not because I'm uncomfortable doing it, because I know it makes other people uncomfortable.
Yes.
Being looked at like,
Yeah, and that's the thing too, I think that, you have to, when you talk about changing a culture, you change it one person at a time.
That's right.
And it might start with your own family. For example, I determined, that with this child 40 years ago, when I nursed in a bathroom, and I finally decided I'm not going to do that. So my daughters feed everywhere, because they've been encouraged to, but to talk about culture, I have a picture over my sink of my two girls breastfeeding, one a brand new baby and one a 9-month-old. And the dishwasher repairman came to fix the dishwasher, and I had to leave, but my husband was there, and I had on my uniform, and so after I left, he said to my husband, is your wife a nurse? And he said yes, and she said, well, where does she work, what does she do? And she said, well, she's the, with lactation, and my husband pointed to the picture, and the man would not look at it. He would not look at it.
He wouldn't have minded looking at that though, would he?
My husband said he said, I'm really glad you weren't here, because we really needed that dishwasher fixed. He said, I just let it go, but I knew that if you had been here, you would have. But it's
when it's like this, it's impersonal and the
Right.
woman is an object. And
Right.
when it's personal,
Personal.
it's embarrassing.
This is very personal.
they're worried about being.
Look at the eyes. Look at the eyes on this baby.
well,
That's extremely personal. You're right. You're right.
we have 43 slang terms for the word breast in this culture. No other culture has that many slang terms for the breast.
So you're saying, oh my gosh, why bother? I'm going home. We're going to be at this forever. We can't fight this. Au contraire, we can fight this.
If you only change one person a year.
I don't even think you have to change. I don't think you even have to change a person.
I mean, I do. I think it starts with nursing students. When I teach nursing students, I always wear a lab coat, because I go through this and I ask them why do they think and all this, and they give me all this hoo-ha that's not real. And I say, no, the problem is, and I do this right in front of them, I say, you guys out here think that these are hooters and these are baby feeders. So if I get those student nurses 8 every 6 weeks, if I only change 2 of them, and whatever.
But look,
Yeah. Yeah.
but look, people, only 4% of women, according to this
Yeah.
big survey,
Get there.
get their information from nurses in hospitals. La Leche comes in, ties with you at 4%. Physician, 1%. Why am I not surprised? But look here. Friends, 13%. Family, 25%. Magazines, books, TV, 25%. Grasp hold of this a minute, okay? Grasp hold of this. In-home visiting staff, 1%. Keep in mind, that's where moms get their information. When do they make the decision? I'm not pregnant. And I've already made up my mind, should I ever conceive, this is what I'm going to do for my baby. And I might have made that up when I saw my mom breastfeed my younger sibling. But I've made that decision long ago. Contemplate that. Our community has to look different. It needs to look really different. I came up with some suggestions, but I don't have any food pantry folks here, but they'll learn this next month. I'll just give you a heads up of what I'm going to ask them to do. These are very basic things that a food pantry can do. And I'm not dragging my moms, my pregnant moms, and assaulting them, because they feel assaulted by all the information they get, don't you think? Get rid of baby pantries that support bottle feed. In other words, an incentive shouldn't be a bottle. It could be many other things. Who doesn't need laundry detergent? Pampers. The world's best, the best incentive. Move breastfeeding moms to the front of the line. Why do I say that? Why? And how many people are in line? 10, 20, 30, 60? And if I say to the line, excuse me, folks, I'm sure you won't mind. This mom is nursing. We're going to move her up to the front of the line in appreciation of her nursing. No, I totally disagree. I totally disagree. I think people are more loving and generous and tolerant of one another than we give them credit for. In the workplace, breastfeeding moms aren't needy or special. They're a community good. They should be acknowledged. Refusing to tolerate any off-color remarks. Display the breastfeeding free to feed sticker. Do not accept no for an answer to pump. If we can have a smoke break, we can have a pump break. And helping moms understand you don't have to accept no. Do we have a place to breastfeed at the health department now? That was a long time coming.
It hasn't yet been promoted, but it's there. You were working on promoting.
How many years has this been in the making? 6 years at a county health department. What can my expectation be for Butterball? What can my expectation be for a tool and die shop, should we have any existing at the end of the year?
Butterball actually had theirs before we did. They called and asked.
Oh, wait a minute. Why was that? Why was that?
Why did they call?
Why did they have it before you did? Who's Butterball's primary employee?
Hispanic.
Hispanic women.
And they had an HR person that breastfed that got involved in push work.
The culture at that place was breastfeeding. How about this within a healthcare setting? Coming right out and asking this. What are the barriers to you breastfeeding this baby? Just put it on the table. What could keep you from doing this? Let's look at it right now this minute and see if there's anything we can do to get around that. Because a lot of times we'll say, are you going to breastfeed? Do you want to breastfeed? Are you thinking about breastfeeding? But we never ask them early enough in their pregnancy what those barriers are going to be. So there's no time to address it. I'm 8 months pregnant. Don't talk to me about barriers. Talk to me about back pain. You know, talk to me about sleeping. Talk to me about who's going to clean my house when I bring this baby home. I'm not talking about barriers to breastfeeding by the time I'm that pregnant. Look at this. Baby-friendly hospital initiative. 8 times less likely to stop breastfeeding before 6 weeks. Why? Why do you think? The culture in that hospital is to breastfeed. Breastfeed is the de facto option, right? In a baby-friendly hospital, they assume every mom will breastfeed and do not find it an inconvenience to provide that information to that mom. This bugs me. This is my own private thing. This is my trigger. How many moms have told me that they got this particular formula at the hospital and that's the best thing for their infant? And I said, no, not really. That was the free thing for your infant. Actually, not only was that the free thing for your infant, that was what the hospital got kicked back to provide for you. Had nothing to do with what was best for your infant. I said, every mom that walks out there is going to get that same formula. And your infant's really different than that one over there. Think about it. The culture in the hospital here leans more toward bottle feeding. New families. I love this. Don't make a big deal out of it. It's just normal that you breastfeed. When your child sees somebody else breastfeed, if they ever have that occasion, it's not a big deal. It's just what moms do. They feed babies like this.
Yeah, I have people call, I need a pump because I have a 9-year-old son and I don't want him to see me breastfeeding. And, so they get the,
That is very real. Because the culture tells us no mom wants to be sexual around her children, right? That's, as a species, that's not what we are programmed to do. We have evolved to separate that for people that are functional and whole. If that mom has any idea that's going to be perceived as sexual, it's not going there. You're right. It's really important, that culture. I think sometimes we don't even realize that we don't know what we don't know. We don't know that we're being not supportive of breastfeeding. I've got a lot of breastfeeding myths here. And because I'm preaching to the choir, I'm not going to go through with them. But I do want to say that I love Jack Newman. Okay? He could just say pretty much whatever he wants. And how many people in the health profession here would agree to this? That after medical school, most information where they get their information regarding infant feeding comes from formula company representatives. Okay. I think that it's okay to let moms and families know that. What do you think? Formula samples don't affect how long a mom breastfeeds. So why do they do it then? Nobody does anything for nothing, right? Nobody. It really does work, or they wouldn't be doing it. This is another one of my favorites. If this was true, we would be extinct. That's all I'm going to say. The species would not exist. Even survivors of the Holocaust were able to nurse their babies. Can it get any worse than that? not that I can configure in my mind, and their milk didn't dry up overnight.
That's one thing that I think a lot of family and friends tell other people too, is I hear a lot of girls who are like, well, if it works for me, I'm gonna do it. Well, it has to work because it's worked for thousands of years. Or my friend couldn't produce enough milk, or this or that, because they're not educated on how to get your milk supply up or anything else.
Exactly. And this is what Newman says about that milk supply thing. It's not because the mother doesn't have enough milk, it's because the baby can't get to it. If there is a problem with not having enough, it's the transfer of milk and breast to baby, right? Right? How much I pump is how much I've got. How much you can pump is how much you can pump. That's all it means. It doesn't mean that's how much you've got. I love this. Does our culture need even one more numerical thing attached to anything? No, I don't think we do either. It's not about minutes, it's about effective nursing, right? Is the baby nursing, or is the baby hanging out and being comforted? It's easier.
Just so you know, that's the only time I've ever worn a watch my entire life.
When you nursed?
My first child, I never wear a watch, but that first baby, boy, I had that watch on my arm all the time.
Because you were afraid, you were worried?
I was timing.
I mean, but I mean, you were worried that you wouldn't go long enough, or it would be too long, or?
I was told. No.
That's what I was told. Oh, yeah.
And I did.
Let them go at least 20 minutes or something.
You get everything they need in.
Well, yeah.
Yeah.
Sure.
Can I ask
I couldn't fail, Alice.
this whole thing about latch, everyone who sees way more babies, are we seeing a rise in babies who are really struggling with an appropriate latch, or mothers?
Yes, because we have more and more we have so many more late preterms, we're having a huge
And
problem.
epidurals.
That's it. The late preterm is enough to send you right over the deep end. Cause and the low blood sugars, we can't, I mean, it's a real problem.
If babies weren't meant to
So it's a common
gestate,
thing for mothers nowadays to have to experience an extended period of time to where the baby can orient neurologically to really make it work. So, because I don't, but I'm sensing that there is this thing where I'm seeing babies, the moms are all about it, but the babies seem to be, I watch the nurse and I go, it's not ordering appropriately, and so there are, okay.
yeah, the babies are meant to gestate for more than 37 weeks, right? That last 3 to 4 weeks is really important. That's like the finishing touch, right? You know, it really shouldn't be easier to bottle feed. But our culture has certainly made it more acceptable to bottle feed, which may be perceived as easier, right?
Husbands can feed them in the middle of the night too.
Now, I just want you to know that this is a direct quote from Newman. This is pretty harsh. Okay? No need to worry about how your baby is, because he is with you. We're not a culture that's real happy about babies being out and about, are we? We're not. They're fussy and squirmy, and they take all the attention. I had to really ponder putting this up, because it hits so many chords for us as a culture. Do we value our children or not? I don't know some days. as a court-appointed special advocate? I really don't know. Oh, we know about this. They can make those formulas sing, right? Come on, we know not. It's not as good.
Now there's premium.
Premium, that's right. What's the next word after premium? Still my favorite is the hearts coming out of the belly. Remember that one, Laura, when they had the hearts coming out of the belly? I mean, pure love. You drink Nestle, what was it, Good Start at that time, and you will have hearts coming from your belly. That's a lot better than colic, isn't it? Hearts from the belly? Oh yeah, I'm on that. I want that kind of formula. Medicine should not breastfeed. Come on. It's just not true. There's not very many meds that you have to say no to nursing. Breastfeeding in public is not decent. I just want to say again that if you download this presentation, this is a direct quote from Newman. It's the humiliation and harassment of mothers who are nursing their babies that is not decent. Whew. Wish I'd said that first. Think about that. But that would be a whole societal shift, wouldn't it? And that's what we need. Once an infant has teeth, you stop nursing, right? Or sooner. That's only happened in the last 100 years. That is not very long for us to evolve out of something that has sustained us through all of creation. We have no idea what the implications are from our rejection of breastfeeding. We don't even know what that means to us as a species yet. We're learning, but we don't know yet. Again, this is from our friend Mr. Newman, Dr. Newman. Breastfeeding is blamed for everything. Yep, if anything goes wrong in that family, if you just stop breastfeeding, it'll be made right. Okay? Hair loss, change of vision, ringing in the ears, itchy skin, marriage problems, other children acting up. Just stop breastfeeding and that will fix it. So, given this set of myths, given the fact that we are thinking maybe outside the box about culture, I want to ask your help. And I want to ask the help of the people close to you. I went for a ride, and I went into the places that I go a lot. The restaurants I go to, the place where I get my hair cut, a couple of art galleries, the museum. Well, that's a lie. In the museum, there was like one of the Dutch paintings with the mom nursing. Okay? There was no nursing images anywhere. How can we begin to address a community change if we are invisible? We can't. So, I've created a slight campaign, a small campaign. My goal, though you can't see, well, I can make you see it. I have 500 of these. By January 1, I would like to see 500 of these stickers in business windows in Kent County, Grand Rapids area. How, you say, would that happen? It would happen if you and your friends wrote a nifty little script. I walk into Big B Coffee. I spend a lot of money at Big B Coffee. I walk in there and I say, hi, my name is Monica Smith. I'm with Michigan State University Extension, and I'm wondering if I was nursing a baby, would you be okay with that? What would your staff think if I was sitting here nursing my baby? If they'd say, well, that would be okay. So you're telling me that you think a mom nursing a baby would be made to feel comfortable here and it would be okay? And they say yes. And I will say, if that's true, would you be so kind as to place this in the window of your business? Because you know what, a lot of moms are afraid. They don't feel welcome, and so they don't nurse in public. And it would be really helpful for moms to know where they're safe. And in return for that, on the back of the script is a little sheet. The name of the business, the type of business, and the person who accepted the sticker. I will put them on our website as a breastfeeding friendly business. Okay? And if I get enough of them, I will go to the great trouble of doing a page instead of just listing them by type. I'll actually put a logo, a scanned logo, like you would see on the back of some magazines where they actually show the logo or the business card. 500 of these. Okay? That's one thing. I also have here, let's say you go, and the young woman at Bigby, who is always so happy and pleasant, she says, but my manager's not here. I can't make that decision. Here you go. It's a little card here that says, thank you for considering this. If you choose to place this in your window, please email me and tell me so, and I'll add you to our breastfeeding friendly list. If they do accept it, business card. Here's a business card. It gives you the website link. That's where you can go and see where other breastfeeding friendly businesses are. You can go, you can look at the website. Likewise, I have freebie posters here. Anywhere that you could tack one, I would love for you to tack one, because everywhere we go, we need to start seeing these images. This one is my particular favorite. If this is not that man's baby, he is a good actor. Look at the way he is looking at that child. These came from the Pennsylvania Community of Public Health. I just added them. They have some information down here. But there's all different kinds of posters here. There are stickers here. But you have to remember, you got to get this back to me, or they don't get on the website. It's a small thing, but I think if we get 500 of these, Wood 8's going to want to know what's the deal with the blue stickers. Don't you think so? And I'm not talking about going to the hospital. I'm not talking about going to your doctor's office. I'm talking about the place that this breastfeeding mom goes every day. The library, the gas station, the unexpected places, the laundromat. I mean, come on, folks, if we can't even have this as a symbol that breasts are for babies, how are we going to compete with the Hooter t-shirt? That's got national recognition, right? I bet you many people are not going to know what this is. But at least somebody will ask. That means free to feed, right? So what do you think?